Okay, so what happens after a hair transplant? For the first week, there's certain things you must do. After 7 days, you forget you had a hair transplant, go back to your normal routine. The first few days, say the first 4 days, what you want to do, avoid direct shower pressure to the top of the head where the grafts are. Why? Because the blood supply hasn't anchored the grafts in yet for about 4 days. So how do we get around that? Because you want to clean your scalp. Take a large cup, place shampoo, place water, pour it on your head, rinse it off the same way, and do that once a day. When I was going through med school and were quite a lot younger, it was always told that scabs are good. We know now scabbing is not good. You want to keep the area moist. So we send you home with the mister. You either put saline in it or an ATP solution that we provide for you and spray it on your grafts all during the day to keep it moist. So you'll do that for about 7 days. After 7 days, all the crusting will be gone, all the redness will be gone, and you won't need it anymore. As far as care of the back, keep this moist as well with a petroleum-based solution like Aquaphor. Place that on there once a day and basically go about your business. When could you color your hair? When can you get a haircut? Coloring the hair is about 2 weeks before the procedure or 2 weeks after. When can you get a haircut? In about a week. If you have to, you can get a haircut, but we prefer about 2 weeks. People say, well, when can I, if I have a job where I'm in public, how much time should I take off? I tell people about a week. In a week's time, a lot of the redness is gone, a lot of the crust have fallen off, and usually you'll look presentable at that time. Pain management after a hair transplant with an FUE procedure usually is not a problem. We give the patient at least 3 days worth of analgesics to control the pain. Hardly ever has anyone asked for more. The pain is less than with a strip because with a strip you get taking out of the skin and closing it up. That creates tension and pain. With our procedure, tiny little incisions are made which actually produce almost no pain. I've had the procedure myself and as far as pain, I don't think I took any pain medicine whatsoever. But everyone's different, but the level of pain, trust me, is much lower than any procedure out there. One final thing I want to say about hair transplantation. We take it seriously, I take it seriously, and I'm a student of hair transplantation. A lot of people always want to know a little bit about your background, so here's a little bit about me. I'm from Chicago. I went to Northwestern Medical School. I was a trauma surgeon and a critical care surgeon in my previous career. I've been doing hair transplants only for about 10 years. I specialize in FUE transplantation. I'm currently involved in several studies improving the quality of the hair restoration product. And I just wanted to say that as long as I've been doing a hair transplant, I've never seen 2 hair transplants that are alike. Each patient is different, the hair's different, the head size different, the expectations are different, and we approach it that way. Hair transplantations work. They work almost all the time. The problem that a lot of people have with hair transplants today is their native hair that is not protected from DHT, they'll lose that as time goes on and they'll think their transplant got thinner, but that's usually not the case. The hair transplanted hair is quite tough and is quite permanent. So I'm definitely an advocate for a hair transplant and I hope to see you soon. You can call our 24-hour line at any time if you're in the middle of the night and have a problem and you want some answers, or you're just watching TV and want to schedule a consultation, you can call us anytime at 312-261-0872. Thank you.